Hello, future nurses. This is Professor Hale. In this video, I will be discussing several important topics related to pressure injuries and nursing care. So I will start with a quick review of the integumentary system. Having a solid understanding of the skin and its structures is fundamental for comprehending how pressure injuries develop and how they can be prevented. Next, I will start to explore the pathophysiology, causes, stages, and the impact of pressure injuries on patients. So understanding these aspects is crucial for effective prevention and treatment. And then finally, we will delve into the nursing care aspect that is required for patients with injuries, pressure injuries. So this includes assessments, preventative measures, and treatment options. Proper nursing care is essential to manage and mitigate the effects of pressure injuries. So by the end of this chapter or this video, you should have a comprehensive understanding of pressure injuries and the necessary nursing care and relevant to the anatomy. So let's get started. So these are key terms to know in your chapter 54. You should be able to define and apply these terms. And here are your learning outcomes in chapter 54. So the integumentary system is composed of the skin and its appendages, which include the hair, nails, and glands. So the skin itself has like three primary layers, each with distinct structures and functions. So let's look at the epidermis. Epidermis is the outermost layer of the skin. It's composed mainly of keratinocytes. It also contains melanocytes, which produce melanin, giving skin its colors, and Langerhans cells involved in immune response. The function of the epidermis layer acts as a protective barrier against environmental hazards such as bacteria, UV radiation, and water loss. It also plays a role in production of vitamin D. Now, looking at the dermis layer, which is located beneath the epidermis, this thicker layer contains collagen and elastin fibers, blood vessels, nerve endings, sweat glands, sebaceous oil glands, and hair follicles. Its function, it provides a structural support and elasticity to the skin. It houses sensory receptors for touch, pain, temperature, and plays a crucial role in thermal regulation through sweat production and blood flow regulation. The hypodermis, which is the subcutaneous layer, is the deepest layer of the skin composed mainly of adipose fat, which is fat tissue, and connective tissue. Its function, it acts as an insulator to conserve body heat and as a cushion to protect underlying muscles and bones from injury. It also serves as an energy reserve. So each layer of the integumentary system works together to protect the body, regulate temperature, and provide sensory information. Okay, let's talk about more of pressure injuries. So what are pressure injuries? There are basically lesions caused by prolonged pressure against the skin, right? Which are a result of tissue anoxia. Tissue anoxia begins to develop within the 20 to 40 minutes of unrelieved pressure on the skin. Causes of pressure injuries are mechanical forces such as pressure, friction, or shearing. So friction is created when the skin surface rubs over the stationary surface, and shearing occurs when the patient slides down in the bed, when the head of the bed is raised, and when being pulled or repositioned without being lifted into bed. So that's why it's important that we have a draw sheet underneath our patients so we can actually lift them up into the bed rather than dragging them. Understanding risk factors is crucial for prevention and effective management. So one of the primary risk factors for pressure injuries is immobility. Patients who are bedridden or have limited mobility are at higher risk because they cannot change positions frequently. This leads to prolonged pressure on certain areas of the body, reducing the blood flow and causing tissue damage. Poor blood circulation can also contribute to the development of pressure injuries. Conditions such as diabetes, peripheral artery diseases, and heart failure can impair circulation, making it difficult for oxygen and nutrients to reach the skin underlying tissues. Patients with impaired sensory perception, those such as those with spinal cord injuries or neuropathy, they may not feel pain or discomfort from prolonged pressure. So this lack of sensation prevents them from recognizing the need to change positions, leading to increased risk for pressure injuries. The elderly population is particularly vulnerable due to several factors, including thinner skin, reduced mobility, and often multiple comorbidities. And also, as we age, our skin loses elasticity and becomes more fragile, and is making it more susceptible to damage. Both very thin and obese individuals are at higher risk for pressure injuries. Very thin patients that may have less cushioning over the bony prominences, which increases their risk for skin breakdown. On the other hand, obese patients, they may have difficulty moving and repositioning themselves, leading to prolonged pressure on certain areas. Also, in addition to that, is adipose tissue is poorly vascularized in obese patients and therefore likely to develop ischemic changes. So, by understanding these risk factors, we can implement targeted interventions to prevent pressure injuries and improve patient outcomes. So remember, prevention is always better than treatment, so let's stay vigilant and proactive in our nursing care practices. So by implementing effective preventative measures, we can significantly reduce incidences of the pressure injuries and improve patient outcomes. So the first step in prevention is to assess the patient's risks using the validated tool like a Brainin scale. This tool helps identify patients at high risk for pressure injuries, and it allows us to implement targeted interventions early. Keeping the skin clean and dry is essential. Daily cleansing removes sweat, bacteria, and other contaminants that can contribute to skin breakdown. It's also important to cleanse the skin as needed, especially after episodes of incontinence. Regular moisturizing helps maintain skin integrity by keeping it hydrated and less prone to cracking. So you want to use gentle, non-irritating moisturizer to keep the skin supple and resilient. Properly cleaning any incontinent episodes is crucial to prevent skin irritation and breakdown. So you want to use gentle cleansers to avoid harsh scrubbing and protect the skin. Applying a moisture barrier that can protect the skin from excess moisture, especially in areas prone to incontinence. This helps prevent maceration and reduces the risk for injuries as well. You want to avoid massaging reddened areas, or bony prominences, as this can cause further damage to already vulnerable skin. So instead, focus on relieving pressure and protecting these areas. So by following these preventative measures, we can create a safer environment for our patients and reduce the risk for pressure injuries. And also remember, prevention is key, and it also requires a proactive and consistent approach in our daily care routine. Continuing with our discussion on the prevention of pressure injuries, let's look at some additional strategies that are essential for maintaining skin integrity and preventing these injuries. So, for patients who are unable to move independently, encourage them to shift their weight every 15 minutes. This helps to relieve the pressure on the vulnerable areas and promotes better blood circulation. For patients who are immobile or have limited mobility, it's crucial to turn and reposition them every 2 hours. This practice helps to distribute pressure more evenly and reduces the risk for pressure injuries. Elevate the heels off of the bed using pillows or specialized heel protectors. This also prevents the prolonged pressure on the heels, which are particularly susceptible to pressure injuries. Um, you want to use padding or protective devices such to the cushion bony prominences, such as elbows, hips, and sacrum. This helps reduce pressure and friction on these areas. Use pressure under reducing mattresses. So this invest in a pressure reducing mattress or overlay to help distribute weight more evenly and reduce pressure points. So these mattresses are designed to provide a better support and comfort for patients that are at risk for pressure injuries. And also, when repositioning or moving patients, you want to use a lift sheet to avoid dragging or pulling on the skin. This minimizes friction and shear forces, which also can contribute to skin breakdown. And also provide nutrition and hydration. So, as we discussed earlier, proper nutrition and hydration are vital to maintaining skin health and preventing pressure injuries. So you want to ensure that the patients receive adequate calories, like protein, vitamins, and fluids to support overall health of skin integrity. So adequate nutrition is essential for maintaining skin integrity and promoting overall health, so which are key factors in preventing these injuries. So ensuring that the patients receive sufficient calories is vital. Malnutrition and weight loss can lead to muscle wasting and reduce padding over the bony prominences, so increasing the risk for pressure injuries. So you want to aim for at least like 30 to 35 kcals per kilograms of body weight per day to meet the energy needs. And then for as far as protein, it is essential for our tissue repair and maintenance. So a diet rich in protein helps support skin health and wound healing. So patients at risk for pressure injuries should consume a certain amount of protein per kilogram of body per weight per day, such as like 1.25 or 1.5 grams of protein um, per kilogram of body weight. Proper hydration is crucial for maintaining skin elasticity and preventing dryness. You want to encourage patients to drink adequate fluids throughout the day, as dehydration can compromise skin integrity and increase the risk for pressure injuries. Micronutrients such as vitamin A, C, and E, as well as zinc and copper, can play a significant role in the skin health and wound healing. So these nutrients support the collagen formation, immune function, and tissue repair. So ensure that the patients have a balanced diet that includes a variety of fruits, vegetables, and whole grains to meet their micronutrient needs. And again, you want to regularly assess the nutritional status of patients, especially those at high risk for pressure injuries. You want to use a tool like the mini nutritional assessment to identify malnutrition early and implement appropriate interventions. That's another thing you don't really need to know, but this is just an example as part of it, a tool that we use to assess nutritional needs. You want to collaborate with a registered dietitian to develop individual nutrition plans for at-risk patients. So again, by focusing on proper nutrition, we can enhance our patients' overall health, and we can significantly reduce the risk of pressure injuries. And also remember, nutrition is a key component of comprehensive care, and it requires a proactive and multidisciplinary approach. Recognizing these early signs is crucial for timely intervention and effective management for pressure injuries. So when you see that one of the first signs of developing pressure injury is pain. So patients may report discomfort or tenderness in the areas that are under prolonged pressure. So it's important to take these complaints seriously, and as pain can be an early indicator of tissue damage. As the pressure injuries progress, they can develop into ulcerated areas. So these wounds can vary in size, depth, and they may expose underlying tissues such as fat, muscle, or even bone. Open ulcers are a clear sign that immediate medical attention is needed to prevent any further complications. Changes in the skin color are another key symptom of pressure injuries. Initially, the affected area may appear red or discolored. So in individuals with darker skin tones, the area may look purple or blue. So as the injury worsens, the skin may become darker, indicating deep tissue injury. So it's important to regularly inspect the skin for unusual color changes, especially over bony prominences. So by being vigilant in recognizing these signs and symptoms early, we can take prompt actions to prevent the progression of pressure injuries. So early intervention, it is key to improving patient outcomes and ensuring effective treatment. So accurate diagnosis is essential for effective treatment and management for pressure injuries. So let's explore the key diagnostic tools and techniques. So the first step in diagnosing pressure injuries is a thorough physical examination. So this involves carefully inspecting the skin for any signs of damage, such as redness, discoloration, or open wounds. The examination should focus on areas over the bony prominences, so as these are the most common sites for pressure injuries. Secondly is culture sensitivity from wounds. So if a wound is present, then you would obtain a culture and sensitivity test. which can be to identify any bacterial infection. So this test involves taking a sample from the wound and analyzing it to determine the type of bacteria present and see if the most effective antibiotics for treatment based on that, the results of that. So this also helps in tailoring the antibiotic therapy to the specific needs of the patient by obtaining the culture sensitivity. Blood supply studies. So assessing the blood supply to the affected area is crucial as poor circulation can impede healing. So techniques such as a Doppler ultrasound or infrared thermography can be used to evaluate blood flow and detect vascular issues. So these studies help in understanding the extent of tissue perfusion and planning for appropriate interventions. Wound biopsy, in some cases, a wound biopsy may be necessary to obtain a definitive diagnosis. So this involves taking a small sample of the tissue from the wound for histological examination. So a biopsy can be help identify the presence of any underlying conditions such as malignancy or chronic infection that may be contributing to the non-healing of the wound. So by utilizing these diagnostic tools, we can accurately assess the severity and the underlying causes of pressure injuries and allowing more effective treatment plans. So early and precise diagnosis is key to improving patient outcomes and preventing complications. So effective treatment involves a combination of strategies to promote healing and prevent further complications of pressure injuries. The first most crucial step in treating pressure injuries is to remove all pressure from the affected area. So this can be achieved by repositioning the patient frequently using pressure relieving devices such as specialized mattresses or cushions and ensuring the patient that is not lying directly on the injury. As far as debridement, this is a process of removing dead and necrotic tissue from the wound to promote healing. So there are several methods of debridement. So we have mechanical debridement. This involves the use of physical force to remove the dead tissue, such as wet to dry dressings, wound irrigation, or hydrotherapy. Enzymatic debridement. This method uses chemical agents to break down necrotic tissue. Enzymatic debridement is particularly useful for wounds with large amount of necrotic tissue. Autolytic debridement. This technique uses the body's own enzymes and moisture to break down dead tissue. It involves the use of occlusive or semi-occlusive dressing that maintain a moist wound environment. We have the surgical debridement. In cases where there is extensive necrotic tissue or infection, surgical debridement may be necessary. This involves the use of surgical instruments to remove dead tissue and is typically performed by a healthcare professional physician. Wound care cleanse. Keeping the wound clean is essential to prevent infection and promote wound healing. Wound cleansing involves the use of saline or other appropriate wound cleansers to gently remove debris and bacteria from the wound. It's important to avoid harsh antiseptics like hydrogen peroxide or iodine, as they can be damaging to the healthy tissue. So by implementing these therapeutic interventions, we can effectively manage pressure injuries and support the healing process. Remember, each patient is unique and treatment plans should be tailored to their specific needs and conditions. All right, let's dive deeper into wound care dressings and the various types. So it is important to understand that dressings is essential for selecting an appropriate one. And this is based on the wound's characteristics and healing needs. So let's start off with hydrogel. Hydrogel dressings are composed of 90% of water and a gel base, and that makes them ideal for providing moisture to dry wounds. So they help cool the wound, provide pain relief, and promote autolytic debridement. Hydrogel dressings are suitable for dry to minimally exuding wounds, partial thickness wounds, and minor burns. Second, we have the polyurethane film. So these are transparent dressings that are made of thin, flexible polyurethane film coated and with an adhesive. So they create a semi-permeable barrier that protects the wound from external contaminants while allowing oxygen and moisture vapor exchange. So polyurethane film dressings are ideal for superficial wounds, surgical incisions, and IV catheter stents. Then we have the hydrocolloid water. Hydrocolloid dressings contain gel foaming agents within a wafer that provides a moist and insulating environment for wound healing. So they are self-adherent and impermeable to bacteria. So this makes them suitable for clean, unaffected wounds with low moderate exudate. So such as pressure ulcers or minor burns. Then we're looking into the biological. So biological dressings are derived from living organisms and include products like collagen, amniotic membranes, and skin substitutes. So these dressings promote wound healing by providing a scaffold for new tissue growth and are often used for chronic wounds, burns, and surgical wounds. Then we have the alginate. Alginate dressings are made from seaweed and are highly absorbent. So they form a gel-like substance when in contact with the wound exudate. So making them ideal for heavily exudating wounds, wounds that have a lot of drainage. Um, Alginate dressings help maintain the moist environment and facilitate autolytic debridement. Gauze dressings are versatile and widely used for various types of wounds. They can be used as a primary or secondary dressing and are available in different forms, like such as pads, sponges, and rolls. Gauze is suitable for covering and protecting wounds, absorbing exudate, and applying topical medications. So most moist environment, so maintaining a moist environment is crucial for optimal healing. So dressings like hydrocels, hydrocolloids, and alginates help achieve this by keeping the wound bed moist, which promotes migration of tissue repair. And also caution with tape. So when securing dressings, it is important to use tape cautiously to avoid skin damage. Choose the right type of tape based on the patient's skin conditions and wound location. Avoid applying tape with excessive tension and use adhesive removers to minimize any trauma during the wound dressing changes. So another thing that you really want to make sure is another thing to be mindful of, that these dressing changes can actually inflict pain on the patient. So pre-medicate them with any pain medications if it's going to be more of an extensive wound. So we should make sure that they're comfortable during the dressing wound and manage their pain as well. So by understanding the different types of wound care dressings and their appropriate uses, we can provide a better care and promote faster healing for our patients. So remember, selecting the right dressing is key to effective wound management. But mostly you're going to see a doctor's orders for these types of wound dressings. So most likely you're going to consult, you're going to notify the physician if you see a wound. They sometimes will have a consult to a wound care nurse. They will come and evaluate, make the recommendations, and the physicians will implement or put in their orders as per the wound care nurse recommendations. For more complicated wounds, we have a negative pressure wound therapy. It is an occlusive dressing applied to the wound with tubing to a vacuum source. A vacuum source exerts gentle negative pressure. This type of wound dressing promotes healing. It removes any the exudate. It provides moist wound healing environment, and also it promotes perfusion and granulation tissue formation. And it draws the wound edges closer together. So here we go. Here's a visual of the various stages of pressure injuries. As you can see, stage 1, the skin remains intact but appears red and it does not blanch. That means it does not turn white when it's pressed. So this indicates a beginning of tissue damage due to prolonged pressure. So the treatment for this, you can apply a transparent film dressing or hydrocolloid dressings that can be used to protect the skin area and prevent further damage. Reposition and patient every 2 hours. Make sure that they're adjusted when they're sitting in a wheelchair every 15 minutes when you can. Then you have the stage 2, which is partial thickness loss, which you see the exposed dermis there. So it's kind of like a superficial opening. The wound bed is typically pink or red, and it may appear to be an open blister or shallow ulcer. You can have either a hydrocolloid dressing, foam dressings, or hydrogel dressings. They're suitable for maintaining the moist wound environment and protecting the wound. And then you have stage 3, you can see, which is there is full thickness skin loss, and the wound may extend into the subcutaneous tissue. So the wound bed may contain eschar, which is dead tissue, or slough, and there may be tunneling or undermining. The types of dressings you would for stage 3, you would kind of use like an alginate dressing, hydrogel dressings, and foam dressings with borders. They're usually effective for managing exudate and managing a moist environment. Okay, and then we have stage 4, which is stage 4 pressure injuries. They involve, like I said, the full thickness skin and tissue loss with the damage extending to the muscle. Sometimes there'll be bone exposed or supporting structures such as tendons or joints. So those are typically your stage 4 characteristics. Dressings for this could be advanced wound dressings such as alginate dressings, hydrocolloid dressings, and foam dressings are used to manage the exudate and protect the wound. Sometimes surgical intervention may also be necessary. Unstageable involve full thickness skin and tissue loss, but the extent of the damage cannot be determined because of there's no wound bed appearance, and it's covered by eschar or slough. Primary goal is to remove the necrotic tissue through debridement. Appropriate dressings include those that promote a moist environment, such as hydrocolloids or hydrogels. And then we have the deep tissue injury, which are characterized by not persistent, non-blanchable discoloration that appears red, maroon, or purple. So the skin may be intact or have a blood-filled blister. Dressings would be foam dressings or hydrocolloid dressings can be used to protect the area and manage exudate while promoting a moist wound environment.
Okay, so now let's discuss nursing diagnosis related to pressure injuries, focusing on impaired skin integrity and the risk for infection. So understanding these diagnoses, expected outcomes, and appropriate nursing interventions is crucial for effective patient care. So let's look at this one here, the impaired skin integrity, and we would be related to skin or pressure on the skin surface. Your expected outcome would be patient skin integrity will improve as evidenced by decrease in size of wound and no development of additional pressure injury. So what are your nursing interventions going to be? So you at least want to have 5 of them. So you want to conduct a thorough skin assessment, regularly inspecting the patient's skin, especially over bony prominences to identify early signs of pressure injuries. The next one would be repositioning the patient every 2 hours. You want to ensure that the patient is turned and repositioned frequently to relieve pressure on vulnerable areas. The third one would be use pressure relieving devices. So you want to implement the use of specialized mattresses, cushions, and heel protectors to reduce pressure on the skin. And then we have the maintain skin hydration. So that means you want to clean the skin and dry the skin daily as needed. And you want to apply moisturizers to keep the skin hydrated as well. And then last, you want to educate the client and caregivers. And this will, by doing so, you need to provide the education on the importance of repositioning, skin care, and the use of pressure relieving devices. And here's our next one here. This is a risk for infection related to open wound. And expected outcome for this would be the patient will not experience wound infection or systemic sepsis as evidenced by clean wound bed. So you want to look at the wound, it should be clean, and temperature and white blood count are within normal limits. So they would be absent of fever and signs and symptoms of infection. So your nursing interventions here would be you want to perform wound care using aseptic technique. So regularly, so the patient will not, so this means you want to cleanse the wound with appropriate solutions and apply dressings using sterile techniques to prevent any contamination to the wound. Monitor for signs and symptoms of infection. You want to regularly assess the wound for redness, swelling, increased exudate, so that means drainage. What does it look like, and other signs of infection. Also, you want to check the client's temperature and white blood count as well routinely. So they may want to do some labs, frequent labs to monitor that. Um, you want to administer prescribed antibiotics. Um, so this, if there's an infection present, you want to ensure the patient receives the appropriate antibiotic therapy as prescribed. You want to educate the client and caregivers. You want to teach proper wound care techniques and the importance of hand hygiene to prevent any infection. And then you want to promote adequate nutrition and hydration. So you want to ensure that the patient receives sufficient nutrients and fluids to support immune function and wound healing. So by understanding and implementing these nursing diagnoses, expected outcomes, and interventions, we can provide comprehensive care to the patients with pressure injuries, and promoting healing and preventing complications.
Okay, so this is what in this slide I'm gonna discuss the critical importance of preventing pressure injuries, and this is emphasized by the National Quality Forum. Um, the National Quality Forum lists pressure injuries as a serious reportable event. So this designation means that the Medicare and many private insurers will not pay for any stage 3, stage 4, and stageable pressure ulcers that are acquired, after admission or in duration of the health into a healthcare facility. So this policy underscores the importance of preventing these injuries and by ensuring high quality patient care. To meet these standards and provide the best care to our patients, it is essential to do a careful skin examination and document with photographs all pressure injuries on admission. Upon the patient's admission, you want to conduct a thorough skin examination. An RN would actually be doing this on an admission. That is the scope of practice, and you could be assisting the RN with this process. You want to So this is important to identify any existing pressure injuries, document findings meticulously, including taking photographs to establish a baseline. So this documentation is crucial for tracking the patient's condition and demonstrating that any pressure injuries were present upon admission. 2, you want to be vigilant with care to prevent any developing or worsening pressure injuries. Prevention is key to avoiding the development or worsening of pressure injuries. Implement evidence-based practices such as regular repositioning, using pressure relieving devices, maintaining skin hygiene, and ensuring adequate nutrition and hydration. By being proactive and vigilant in our care, we can significantly reduce the risk pressure injuries and improve patient outcomes. As an example, how research improves patient outcomes. This is an example of a study. So a critical care unit implemented a comprehensive quality improvement initiative that included empowering certified nursing assistants to reposition patients. And this is using a clock system, applying a foam sacral dressing, and updating important support services. So these interventions led to a significant reduction in hospital-acquired pressure injuries, and is achieving a rate of 0 per 1,000 patient days over a 4-month period. So that was a really good outcome for them. Another one was like reducing surgical health-acquired pressure injuries. So another case was a healthcare system in Western United States. They successfully reduced surgical health-acquired pressure injuries to 0% over 48 months by improving care processes. So they conducted a system-wide audit, implementing a risk assessment tool and enhanced perioperative documentation. So these efforts led to a better identification of high-risk patients and improved patient outcomes. So those are little examples. So by adhering to these practices and learning from successful case studies, so we can enhance the quality of care we provide to our patients. Preventing pressure injuries is a critical aspect of patient safety, and it requires a dedicated and consistent approach from all healthcare providers. This is just an activity for you all just to kind to complete and to review and go over to tie in everything what we've discussed on the pressure injuries. So in this case scenario, just kind of identify the Braden score. What are the identify risk factors? I kind of identify those risk factors that are stated within this scenario, so don't go beyond. And also list 5 nursing interventions and rationales for this patient. Here over to the right, you'll see a little pyramid there of Maslow hierarchy of needs. I want you to kind of think about those rationales when you once you implement those, kind of categorize them or prioritize them based on Maslow hierarchy of needs. So how this works is you need to address from the foundational needs, which is physiological needs first, and then you move up, and that's how you prioritize. So try to think about your nursing interventions and think about how are you going to prioritize them based on this case, this scenario. All right, good luck, and I'll see you in class.